Good morning, everyone. Can you hear me? Okay, I will wait for the others for a few minutes before I start. Okay, I will wait for a few minutes before I start. Okay, I will wait for a few minutes before I start. Okay, I will wait for a few minutes before I start. For a few minutes before I start. Okay, good morning, everyone. I think we can start now. So, welcome to our another live stream for VA Bootcamp Training Services. So, for today, we will have five topics, and our focus will be communication and soft skills. Again, our topic for today is about communication and soft skills. Okay, so let's proceed with the first slide. how to write medical emails and follow-up messages. So this topic is very important because almost every day you will encounter emails and messages coming from your client. All right, let's begin. So how to write medical emails and follow-up messages. So first is you have to use a professional email address. So ensure that your email address reflects your role or your organization. So usually companies use same as this example for Dr. Smith at hospital.com. Usually, company emails, the ending part is all usually they use .com or .org, and they don't use personal email. Okay, and then craft a clear and engaging subject line. So whenever you will be sending out messages, you have to keep it concise and informative, such as follow up on your recent appointment, lab results update, next steps, or reminding upcoming health checkup. So it means that on the subject matter, the main core or reason why you are sending an email, you have to be clear on the message starting from the subject. All right. Next is maintain a professional and empathetic tone. Always use polite and respectful language. And then you also have to show empathy, especially when discussing health concerns. Number four, you have to structure your email clearly. So there should be a greeting. So address the patient formally. Put the complete name. And then you have to state your purpose. So clearly state the reason for the email. And then next is the details. So you have to provide relevant information such as appointment dates, test results, or next steps. And then there should always be a call to action. So you have to encourage the patient to schedule a follow up or reach out with questions. And then there is a closing and with a warm and professional sign off. It can be best regards, cordially yours, or respectfully yours. Right. Next. All right. Number five, you have to ensure confidentiality and compliance. So you have to avoid sharing sensitive medical details unless necessary. And then you always have to follow HIPAA or other relevant privacy regulations. Next is to use follow-up email templates. So usually companies do have their own templates. It's curated or specifically designed depending on the content of the email. So for example, so for post-appointment follow-up, you can put there, we hope your recent visit went well. If you have any concerns, please reach out. And then another example, if there's a missed appointment reminder, we noticed you missed your appointment. Let us know if you'd like to reschedule. And then lab results notification. An example will be your test results are ready. Please contact us to discuss them. So usually follow-up emails, there is already a ready designed templates that you can automate or just copy paste whenever you need to send it. All right, you don't have to create every time you will be sending out follow up email. All right, so that it will save time and effort on your end. If you have any questions, you can utilize our chat messages and then I will try to answer it later. All right. And then next is effects of writing good emails and follow up. So primarily it will improve patient engagement. So clear and timely follow-ups help patients feel cared for and encourage them to stay proactive about their health. Number two, strengthen professional relationships. So, well written emails foster trust and credibility with doctors, patients, and colleagues. And then number three, there's an increased response rates. So, a structured and engaging email makes recipients more likely to reply, reducing communication gaps. And then last is enhance clarity and efficiency. Of course, you have to be concise and well organized emails. It will prevent misunderstandings and streamline workflows. All right. Next is better appointment adherence. Okay, so follow up emails reminding patients of upcoming appointments or test results improve compliance. And it also basically increase the percentage of patients doing the appointments if you have a better appointment adherence. Next is higher patient satisfaction. So, personalized and empathetic communication makes patients feel valued and understood. We can also reduce the errors in medical communication. So, clear instructions and follow ups minimize mistakes in prescriptions, treatments, and patient care. So, there's an increased conversion in healthcare marketing. Of course, this is very useful because well crafted emails can help medical professionals attract and retain patients as well. Okay, do's in writing good emails and follow up. So you have the to avoid the using a vague subject line. So avoid generic subject lines like follow up or checking in. They don't provide enough context and may be ignored, right? Overloading with information. So keep emails concise. Too much detail can overwhelm the recipient. So you have to be concise, and if you can do it in a bullet type, then it's much better. Using unprofessional language, so avoid overlay, casual phrases or slang. Maintain a professional tone. And then forgetting to personalize. This one is important. So generic emails feel impersonal. Always address the recipient by name. Not including a clear call to action. So you have to ensure the recipient knows what action to take next. That is very important because what is the sense of sending an email if there will be no action plan? The very reason you are sending an email is to give a message and proceed with an action plan for it or a resolution. Okay. Okay, next is sending emails at the wrong time. So avoid sending emails too late or too frequently as this can be seen as intrusive. Another example for sending emails at the wrong time for example your client or your patient or the doctors, they have their own specific time in the office or in the hospital or in the clinic. Make sure you know all those times so that when you send the email, they will definitely be able to read it. And avoid sending emails after office hours or on the weekends. It's because it will just be in their inbox and they will not be able to reply at it urgently. All right. Ignoring follow up etiquette. So don't send multiple follow ups too soon. Give the recipient time to respond. So ideally, if you will be sending out an email, wait at least 24 to 48 hours for the response. All right. And then if it's urgent, it should be answered within the day, right? Using complex medical jargon. So patients may not understand technical terms, so keep the language simple. So this one is very important. It's because if the recipient of the email is not medically inclined with terminologies, of course, you have to make it simple, or if possible, use layman's term so that the patient will understand what is your message. Do not treat everyone as doctors or nurses who understand complicated medical terms or diagnostics. Okay? Forgetting to proofread, types and grammatical errors can make emails look unprofessional. So before sending out, of course, you need to check on the grammar, check on the spelling, and check on the completeness of the message. There might be some part of the message that is missing, attachment that is missing, or important information that should be included in the email. Okay. Not keeping emails HIPAA compliant. Avoid sharing sensitive patient information unless using a secure platform. So, what are those patient information that should not be shared? So, basically, their SSN number or their tax identification number that should not be included in every email. And if sending out information that is basically on the patient side, there should be a secured platform wherein you can send it, not just an ordinary Gmail. It's because you have to be following HIPAA compliance regarding patient details or information. All right. Do you have any questions so far before we proceed with the next topic? So again, this topic is about how to write medical emails and follow-up messages. Okay, if you don't have any question, let's proceed with the next topic. All right, so since our topic today is communication and soft skills, so another module is how to take accurate phone messages for medical practices. So this is more on the inbound and outbound receiving calls and outgoing calls. All right. Let's wait for a few minutes for the others to join. Okay. Next. So, how to take accurate phone messages for medical practices? So, use a standard message form. So, always record messages on a standardized form or electronic system. So, this includes fields for the caller's name, phone number, reason for calling, and urgency level. So, you have to write legibly and clearly. So, if you are using paper forms, ensure handwriting is clear and easy to read. Avoid abbreviations that could lead to misinterpretation. All right, next is you have to confirm and repeat the information. So once you receive the call, you have to repeat the caller's name, phone number, and the message details to ensure accuracy. Ask clarifying questions if needed. So it's very important that you repeat it so that the caller on the other line will be assured that you definitely understand what is the message. All right. Record the date and time. So always note when the call was received. This helps track response times and follow ups, especially if you will be using time tracker. So most companies that are handling inbound and outbound calls, they always use time tracker. So they only have allotted times on or allotted minutes on how long you will be on a specific call. You have to resolve it right away and do not stay too long in the call. Okay. Identify the intended recipient. So specify which doctor, nurse, or department the message is for. If unsure, you ask the caller for guidance. You have to know the call is for whom. It's because you can definitely transfer the call to the appropriate admin or staff. If you will be the receiver of the call, it doesn't necessarily mean that you are the appropriate person to resolve any concern, right? So, for example, the caller is asking for a specific lab result or appointment schedule. So, if you are not the appropriate personnel to answer that concern, you have to connect the call or transfer the call to the appropriate staff, nurse or doctor. All right. Next is maintain confidentiality. So you have to follow HIPAA or other privacy regulations when handling patient information. So avoid discussing sensitive details in open areas. So you have, and next is you have to deliver messages promptly. Ensure messages reach the appropriate person as soon as possible. And then use electronic systems for faster communication when available. If you will be working with a client, usually all companies have their own platforms wherein you can use. Others are using Ring Central, others are using Dialpad, and it depends on the company on what platform they will be using as a means of communication. But they always do have their own. All right. So it's always an electronic communication when it comes to receiving calls. Okay. Next is what are the don'ts? All right. So, number one is failing to gather complete information. So, whenever you receive a call, the missing key details like the patient's name, the date of birth, or reason for the call can lead to miscommunication. So, you have to gather it all so that you have the complete information or you have the complete picture of what the concern is. All right. And it's very important also to verify this information so that you know whether the caller is the patient itself or the caller is just a legal representative or relative of the patient. Okay. Next is not prioritizing urgent messages. Ignoring the urgency of a patient's symptoms can delay critical care. So, when receiving calls, we usually tag them whether the urgency is high, moderate, or low. So, you should be aware whether a certain message is the urgency is whether it's high, moderate, or low. So if it's a high urgency, then you have to notify um, right away the appropriate doctor for that patient. Okay. Using unclear or vague language, messages should be specific and detailed to avoid confusion. So, forgetting to confirm details, always repeat the information back to the caller to ensure accuracy. And then next is not documenting messages properly. So incomplete or illegible notes can lead to errors in patient care. If you will be handling calls, it's very advisable that you always have your notepad. Okay, do not rely on your memories because you cannot take all those information by memorizing. So always be ready with your notepad and make sure that every time you answer the call, it should be recorded so that if you miss something or you think you didn't understand clearly how the caller speaks because of the accent, at least if you have the summary, if you have the recording, you can go back to the call and finalize the details. Okay. Next is ignoring HIPAA compliance. So ignoring HIPAA compliance means never discuss sensitive patient information in an unsecured environment. So what are those? For example, their diagnosis, their care plan, and important details regarding their health conditions. Okay. Next is failing to follow up. If a message requires action, ensure that it is relayed and addressed promptly. If it is urgent, it has to be addressed right away. Multitasking while taking messages. So, this is not advisable. It's because these distractions can lead to mistakes in recording important details. And then using abbreviations that can cause confusion. So avoid the shorthand that could be misinterpreted by medical staff. So don't try to use abbreviations because your abbreviation might have a different meaning when somebody else read it. Okay. Not training staff on best practices. So there should be a regular training that ensures consistency and accuracy in message taking. So, of course, before you do any task, you should have undergone proper shadowing, proper training, so that when implementation comes, you will avoid any mistakes or errors. Okay, so training is very, very important. Okay, another don'ts on accurate phone messages for medical practices. Okay, the page is still loading. Okay, so not asking for a callback number. Always confirm the best number for returning the call to avoid delays. Sometimes the caller, they are not using at the time their actual phone number. So at the onset of the call, you always have to ask, can I have your best callback number just in case our call got disconnected? That is very important so that if the call is disconnected, you will be able to do a return call. Okay. Misinterpreting urgency. So you have to ensure that you understand whether the issue requires immediate attention or can wait. And then next is failing to note the date and time. Always document when the call was received for accurate tracking. And then not using a standardized format, inconsistent message taking can lead to missing critical details. Usually, most clinics and hospitals, they have their own template. Okay, so you don't have to design your own script or templates whenever you receive a call. You have to follow what is on the guidelines You have to follow company templates whenever receiving calls and whenever doing an outbound call so that everything is highly organized. All right, next slide. Still loading. All right. Forgetting to verify the caller's identity. So you always have to confirm the patient's full name, the date of birth to avoid mix-ups. Especially if there are patients that have the same name. So for example, you have patient 1, the name is John Smith, different diagnosis, and then you also have another patient 2, the name is also John Smith, but have this a different date of birth, different address, and different diagnosis. That is why it's very important that you have to get the date of birth so that you will have a comparison which one is the correct caller. In the US, sometimes patients have similar names and similar addresses, but they don't usually have the same date of birth. So that is very important to take note. And then allowing distractions. So this is a don't as well. So background noise or multitasking can lead to errors in recording my messages. So when you will be working as a medical VA, of course, you have to make sure that you have a specific room or an enclosed like a remote office in your house so that you will be able to avoid unnecessary noise in the background. All right. Not relaying messages promptly, so delays in passing messages to the appropriate person can impact patient care. So what does it mean? So for example, you receive a call and then that patient needs the lab result right away so that the doctor can read the result. And then you forgot to inform the patient that the result is already done and the patient can do the appointment. All right. So always make sure that there's an urgency on relaying information to the appropriate staff or to the patient as well, because it will definitely affect the patient care or the care plan of this patient. All right, let's proceed. I'm trying to answer some of the questions. This live is only for MGA. No, the live is for everyone. Whether you're a general admin or a general VA that would like to learn, you can learn from this live as well. Because email management, even if you're not a medical VA assistant, you will definitely do email management. Answering phone, this is not limited to medical VA, because if you will be a personal assistant or executive assistant, of course, you will also handle email, you will also handle phone calls, right? So you have to treat this as a general knowledge as well, not only exclusive to medical VAs. I hope I answer your question. All right, let's continue. Using unclear handwriting or abbreviations. If you are using paper logs, you have to ensure that messages are legible and avoid confusing shorthand. But nowadays, usually we only use notepads. All right, so everything is digital, everything is electronic in nature. Okay? Ignoring follow-up protocols. If a message requires action, then you have to ensure it is addressed and followed up accordingly. The training staff on best practices, I think we already discussed this earlier. Shadowing and training of staff is very important so that we will avoid any errors or mistakes in the future. All right, next we have to improve patient safety. So ensure that the critical information is relayed correctly. So reducing the risk of medical errors, help prioritize urgent cases for timely intervention, and then enhance communication efficiency. It reduces misunderstandings between patient, staff, and healthcare providers, ensures doctors receive complete and accurate details for better decision making. Okay, increase the patient satisfaction. So patients feel heard and valued when their concerns are properly documented and addressed, of course. And then timely responses improve trust and confidence in the medical practice. And then reduce the legal risk. So proper documentation of phone messages helps protect medical practices from malpractice claims. And then it also ensures compliance with healthcare regulations and HIPAA guidelines. So we have to be very careful when taking in messages, and you have to make sure that the messages or the calls, when you put it in your notepad, it has to be accurate and complete. All right, next is streamlined workflow. Organized messages, so taking prevent delays in patient care and administrative tasks, helps staff manage appointments, prescription requests, and follow-ups more efficiently. And then better coordination among medical teams. So accurate messages ensure seamless communication between nurses, doctors, and administrative staff. And then it reduces the chance of miscommunication that could affect patient treatment. So, this topic that we're discussing right now is about handling calls. When you are receiving calls, what are the things that you need to practice and observe? All right, next is increased productivity. Still loading. So increased productivity, it means minimizes the need for repeated calls due to unclear or incomplete messages. So it allows healthcare providers to focus on patient care rather than resolving communication errors. So if we are able to get the correct information, we are able to get the concern and resolve it right away, then there's a probability that this patient will uh, don't have to call us again or don't have to call the clinic again just to repeat the same concern. All right. So this will be the last topic for how to take accurate phone messages. All right. And then we will just pause for a minute and then let's proceed with the next topic. Next will be how to handle difficult patient calls. All right. Next topic will be how to handle the difficult patient calls. For those that are joining right now, our live stream for today, the topic is about communication and soft skills. So, our first topic that has been discussed, or the first module, is about how to write emails. And then the next one is how to take or how to record messages when receiving calls. And then this is already the third module for those who just joined, how to handle difficult patient calls. All right, let's start. Okay, so we have 19 participants on the line. Good morning to all these 19 participants. I hope you are learning in this live stream webinar. All right, let's start. How to handle difficult patient calls as a virtual assistant. So, of course, not all the calls that we will be receiving are good calls, right? Some are calls that have complaints or some have concerns. And then how are we going to handle all these types of calls? All right. So these are the steps that we can do. So number one, you have to stay calm and professional. Keep your tone calm and composed, even if the patient is upset. And then avoid reacting emotionally. Maintain a respectful and reassuring demeanor. All right. And then next is listen actively. So let the patient express their concerns without interrupting. Let them talk first. Acknowledge their feelings by using phrases like, I understand your frustration and I want to help. All right. So usually, when we receive the calls at the onset of the call, they are already relaying their messages, their frustration, their emotions. So you have to let them vent out, just let them speak. And then of course you have to reassure them that, and they have to feel also that you have the intention to help. All right? Because even if they cannot see you, they can feel whether you are interested to help them with their concerns or not. All right. So always make sure that the intention to help is in there. Next, use clear and compassionate language. I'm on the next slide already, still loading. Okay, use clear and compassionate language. So you have to speak slowly and clearly, avoiding complex medical terms if they are not necessary, and then provide clear steps or solutions while showing empathy. Empathy is very important during the call. Maintain boundaries and stick to your role. So if the issue is outside your expertise, politely direct the patient to the appropriate healthcare provider. When we say healthcare provider, these are doctors, specialists, or medical staff, right? Avoid giving medical advice unless authorized to do so. So if you're not the assigned doctor or the primary care physician of this patient, do not give any medical advice because you don't know the medical abstract, the diagnosis, and care plan of this patient. Okay? All right. Another way of handling difficult patient calls, you have to de-escalate tense situations. Okay, the escalation. So if a patient is already angry, try to diffuse the tension by remaining neutral. Offer solutions and of course reassurance that you will be able to help them. Okay, and then you have to avoid arguments. Do not argue with the caller. Okay, so if the caller is already frustrated, don't let the caller feel that you're also frustrated. Okay, document important details. So you have to keep records of the conversation, including key concerns and follow up actions. If needed, escalate the issue to the right healthcare professional. So usually, most clinics or hospitals, if the concern is urgent and needs to be resolved right away, they usually have a resolution team that will address the concerns. All right. Next is follow up when necessary. If there's a resolution and it is not immediate, let the patient know when they can expect an update. So you have to show attentiveness that builds trust and reassurance. Stay solution oriented. So instead of focusing on the problem, if they already relay to you the concern, so guide the conversation toward possible solutions. And then offer alternatives if the patient's request cannot be fulfilled exactly as they want. So sometimes there are options that you can give to the caller in order to resolve their concerns. All right. Next is the redirect the aggressive behavior. So if a patient becomes hostile, politely but firmly steer the conversation back to the issue at hand. It's because sometimes when they are mad, they talk a lot, and you have to make sure that you focus or redirect them to the main concern. Okay. If necessary, inform them that abusive language will not be tolerated. This is very, very common among patients who are very upset and frustrated. Okay, so they are not allowed to use any abusive language, and then you also have to report it to your supervisor or to your manager if there are some patients that are using abusive language when they are irritated or upset. Okay. Always use positive language. So instead of saying, I can do that, or you can try to say, here's what I can do for you. Right? So it's like reassuring that there's a possibility or option to their concerns to be resolved. Okay? It's not giving false hope, but at least you are doing your best that you will be doing something regarding their concern. Okay? Framing responses positively can help keep the conversation constructive. So when you are in a heated argument, make sure to at least pacify the emotion of the caller or the patient. Okay, next is know when to escalate the call. Okay. So, if a patient's concern requires medical expertise, promptly refer them to the appropriate healthcare professional. So, if the situation becomes unmanageable, so follow your organization's escalation protocol. And then you also have to practice self care, of course. So, handling difficult calls can be stressful. So, take your breaks when needed. And then reflect on challenging interactions to improve your approach for future calls. Because when answering calls from difficult patients, usually you have to create your strategy on how you will be able to de-escalate the concerns and also give utmost response or resolution to this concern. All right. Next, mirror their concerns. Still loading. So, what do you mean by mirror their concerns? So, you have to repeat their concerns back to them to show an understanding. Okay, it's like rephrasing. So, an example is I hear that you're frustrated about the delay and I want to help resolve this. Okay, this is called paraphrasing. And then use the power of silence. Sometimes a brief pause after a patient expresses frustration can encourage them to calm down and continue the conversation more rationally. Because the if the caller or the patient already went out or have already released their anger or frustration, then if you have to pause for a few seconds, then they will be able to breathe and at least they will be pacified because they already relayed what are the concerns or the reason of their call. Okay, next you have to offer alternative solutions. Okay, offering alternative solutions. So if a patient request cannot be fulfilled exactly as they want, you have to suggest alternatives that still meet their needs. So, for example, in appointment scheduling, okay, the patient said, "Oh, I will not be available on that date, on that time." Okay, so give the patient other options or other schedules wherein the doctor and the patient can meet during the appointment. Usually, this is very common for telehealth. So, the availability of the patient and the doctor, if there's a difficulty to match their schedule, then you always have to give options or alternative solution to this patient so that the appointment will be booked properly. Next is maintain a friendly yet firm tone. So being overly apologetic can sometimes make patients feel like their concerns aren't being taken seriously. So you have to balance empathy with professionalism. Okay, so the tone is very, very important when answering calls. It's because you have to be confident that they will feel and reassure that their concerns will be having a solution. Okay, it's not always fine to always say sorry and then you will not give solution. Okay, it's okay to apologize that about delays or shortcomings of the uh, company, clinic, or hospital, but make sure that you also uh, promise that there will be a solution to their concern or the reason of the call. Okay. Okay, next is keep a cheat sheet of common concerns. All right, next is keep a cheat sheet of common responses. What does it mean? So you have to have a list of pre-written responses for frequent concerns. that can help you stay consistent and efficient. So if you will be receiving calls on a daily manner, of course, you already know what are the common trends or what are the common issues that these patients are calling. Okay, you can use a spreadsheet or you can use a any project management tool to help yourself be organized. And then if you are able to identify the common concerns, then you will not get overwhelmed on the next time that you receive the call because you already structure it on how you will approach the client, how you will handle the client, and how you handle that common issue. So it will be easier for you on the future calls. Okay. Know when to end the call. So if a patient becomes excessively aggressive or refuses to engage constructively, politely, end the conversation and escalate if necessary. All right. Especially if you are not the appropriate person to resolve the concern, you have to transfer the call or you have to let the patient call the appropriate provider. You can provide the direct number or the extension number of that doctor or specialist. All right. I hope you learned that from here. So our third module is how to handle difficult patients as a virtual assistant. So this is our third module. So we have 5 modules for today. We are already on the third module. Okay, so our fourth module is how to communicate professionally with doctors and patients. Okay, so for those who have just joined right now, so our live stream for today, the topic is about communication and soft skills. So on the first module, we already discussed how to answer email because email is a form of communication. So the first topic earlier is how to write medical emails and follow up messages. All right, and the second module that we discuss is how to take accurate phone messages for medical practices. Okay, and then we're also done with how to handle difficult patient calls as a virtual assistant. And then we are now on the fourth module, how to communicate professionally with doctors and patients. All right, let's start. How to communicate professionally with doctors and patients. So, communicating professionally means it requires clarity, empathy, and respect. So, whether you're a healthcare provider or working in a medical setting, here are the key principles to keep in mind. All right, let's see on the guidelines. Okay, so number one, be clear and concise. So you have to use precise language and avoid unnecessary details. Number two, you have to use medical terminology appropriately. So if you're in a healthcare role, speak in terms doctors understand but don't overcomplicate things. Respect their time. So doctors are often busy. So organize your thoughts before speaking. And then you have to listen actively. Show that you value their expertise by listening carefully to their input. Remain professional, so you have to maintain a respectful tone and avoid overly casual communication. So even if you will be working remotely, you also have to observe proper communication with doctors, especially during a call. Okay, even if you are not in person communicating with them, it can be through email or through phone. You still have to observe these guidelines, right? Be clear and concise, respect their time, listen actively, and always remain professional. Okay, next is you have to use structured communication tools. So, frameworks like SBAR, so it means situation, background, assessment, recommendation. It will help ensure clarity in medical discussions. And then also, you have to adapt to their preferred communication style. So, some doctors prefer concise emails, while others may appreciate detailed reports. So, it depends on the client. So, you have to adjust whatever the client is requiring you for the task. Next is you have to be proactive, so anticipate their needs and provide relevant information before they ask. Stay updated on medical trends, so being informed about industry changes can make conversations more productive. And then respect hierarchies. Okay, so understand the chain of command in medical settings to communicate effectively. So it only means you have to know who is the supervisor, who are the admins, and then who are the managers, so that you understand the chain of command in your organization or in your company. It's because even if you will be working online or this will be a remote job, of course you have to know the organizational chart of the company you're working with. You have to know who are the doctors, who are the admins, who are the supervisors. Next is how to communicate with patients. Okay, we have um, less than 20 participants right now. Thank you for watching. I hope you are learning, everyone. Okay, next is how to communicate with patients. We're done with the doctors. Now let's go to the patients. Of course, you have to use simple language, so avoid medical jargon that might confuse them. Then next is you have to show empathy. You have to recognize their concerns and emotions with warmth and understanding. Encourage questions. So you have to help patients feel comfortable discussing their health. And then you have to maintain confidentiality, which is very important, HIPAA compliance. Never disclose personal health information in inappropriate settings. Be patient and supportive. So some patients may need extra reassurance or explanations, especially if your patient is an elderly. Of course, you have to have a lot of patience when discussing something to an elderly. It's because sometimes they cannot hear you clearly, and then you may need to repeat yourself just to be cleared with the instructions. All right. Another is use active listening techniques. So you have to repeat key points to confirm understanding, and you have to show engagement as well. Personalize your approach. Adjust your tone and explanations based on the patient's background and concerns. So personalizing your approach is it means that the caller have to feel that they are really talking to a real human. Okay, because nowadays there are a lot of calls that are answered by AI, right? But if you will be handling patients, most companies still wants real human. Okay, it's because these are people. They are medical or medical field or healthcare niche. We engage with people. That is why most clinics or hospitals still needs real human interaction. All right, so don't be worried if someday customer service will be replaced by AI. I don't think so because we need human touch. Okay, it's very different when a real human person is engaging with another human person, not just an AI that is very robotic when answering. All right. Next is provide written summaries. So, giving patients a summary of their visit can help them remember important details. So, if you are giving a recap or summary of the visit, then it's easier for them to remember what happened during the visit. Okay. And then use visual aids. You can use diagrams, charts, and videos that can make complex medical information easier to grab, grasp. So this is for patients that are in the actual appointment. All right. So encourage shared decision making. So you have to involve the patients in their treatment plans to improve adherence and satisfaction. So the patient should know their treatment plan so that it can be implemented properly. All right. Next is common communication pitfalls with doctors and patients. So what are the strategies that we can use? So first, we have to discuss with the doctors. So you have to use active listening techniques. So repeat key points to confirm understanding and show engagement. So you have to personalize your approach. I think we already discussed this one. Okay, the next slide is fading to prioritize key information. So you have to provide um, or providing excessive details without highlighting the most critical points can lead to confusion. Okay, so you have to prioritize which one is the critical ones. Okay, not adapting to the communication style. So some doctors they prefer brief summaries while others appreciate detailed explanation. So you have to learn what is the communication style of your client, all right, your doctor or your provider, so that you can adjust and adapt. Okay. Ignoring nonverbal cues. So body language and tone can indicate frustration or urgency that words may not express. So for example, you are on the call, you're on the phone, even if you are not seeing them, even if that is just a virtual call, of course you can feel if the recipient of the call or the caller itself is frustrated, if they're upset, if they are happy, if they are satisfied with their call, if their concern is able to be resolved. Even if you cannot see them, you can definitely feel it when they are communicating. Okay. Overusing technical jargon, we already discussed this. So while doctors understand medical terminology, excessive jargon can make discussions inefficient. So it means you need to make communication as simple and as concise as possible. Okay? Lack of assertiveness, it means hesitating to ask questions or clarify instruction can result in errors in patient care. So sometimes you have doubts, you have questions, so you have to ask it. All right, don't feel awkward or don't feel afraid. Not asking questions if something needs to be clarified. Because if there's no assertiveness in asking, the result will be error or mistakes. It's because You feel ashamed or awkward in asking the doctor for clarification, and then the result will be just errors. So we need to avoid that. All right, next is failing to address emotional concerns. So patients may need reassurance beyond just medical facts. So this one is for the patients concern. And then providing too much information at once, so overloading patients with details can make it difficult for them to process key points. So you have to be specific. Okay, what are the information that is just needed by the patient? You don't have to overshare information that is not needed at the moment. All right. And then not checking for understanding. So assuming patients grasp everything without confirming can lead to non-adherence. And then using a dismissive tone. So patients may feel unheard or undervalued if their concerns are brushed aside, meaning as if you don't have concern. It doesn't matter whether the concern is resolved or not, they can feel it. Okay. Skipping follow-ups or not checking in after providing instructions can result in misunderstanding or missed treatments. All right. So these are the last key points for this topic: how to communicate professionally with doctors and patients. All right. Let's pause for 1 minute. We still have one module to go. I hope everyone is learning. All right. Our next module will be how to be a reliable remote team member in healthcare. This will be our fifth slide or fifth module for today. How to be a reliable remote team member in healthcare. All right, let's start. Okay, I hope everybody can see. It's a little bit small. The fonts are a little bit small. Okay, anyway, so let's start. So the first one is you have to maintain clear and professional communication. Okay, so use secure messaging platforms and video calls to stay connected. Respond promptly to emails and messages to show reliability, and then keep communication concise but informative. All right. So what we're discussing right now is how you will become a reliable remote team member. Okay. And then second is you have to stay organized and self-motivated. So set daily goals and prioritize tasks effectively. So you can use digital tools like calendars and task managers to track responsibilities. So you can also maintain a structured work routine to stay productive. So everything has to be highly organized. Okay, third one is you have to follow healthcare compliance and security guidelines. Okay, I'll repeat. We are already on number 3. Follow healthcare, compliance, and security guidelines. Okay. So we have to ensure that the patient data is handled securely and in compliance with regulations. So use encrypted communication tools and follow HIPAA or other relevant privacy laws. So you have to collaborate effectively with your team, participate in virtual meetings, and contribute actively. Be proactive in offering support and solutions, and foster teamwork by sharing updates and insights. Right. So teamwork is very important when you will be working in healthcare or as a medical virtual assistant. It's because if you will practice teamwork, your task will be much lighter, because if you have a concern, somebody from the team can help you out, and vice versa. If somebody needs help from you, you can definitely help also others. Okay, so working as a medical virtual assistant, you really have to practice working in a team environment, because you cannot survive alone. There are tasks wherein you will be needing help from others. For example, system issues, or if you need information from other departments. So teamwork is very important. Okay, number five, you have to adapt to technology and remote work tools. So familiarize yourself with electronic health records or EHR and telehealth platforms. So stay updated on new digital tools that improve efficiency. So if you will be hired by your client, most of the clinics and hospitals, they have their own EHR system, right? And then number six, you have to maintain work-life balance, set boundaries between work and personal time, take breaks to avoid burnout, and maintain focus. So you have to make sure that you follow log in, log out, and you also follow breaks. Okay, it's not advisable to do the task continuously in very long hours. Ideally, you have to take breaks every 2 hours so that you can rest and then focus. Next is prioritize time management and efficiency. So you can use scheduling tools like Google Calendar or healthcare specific platforms to stay organized. Set boundaries between work and personal life to avoid burnout. So block time for focused work while allowing flexibility for urgent tasks. Strengthen remote patient engagement. So even if you will be working remotely, it doesn't mean that you will not have a patient engagement. Okay. So you have to show empathy and active listening skills when communicating with patients. And then you have to ensure telehealth consultations are smooth by testing technology beforehand. So what does it mean? Before you schedule a patient using telehealth, make sure you practice it first, right? So that there will be no technical issues when the patient log into your telehealth platforms. Everything is working seamlessly. Okay. Provide clear aftercare instructions and follow-up communication. So, for example, after the appointment or after the telehealth, usually companies have aftercare instructions for the patients. Okay, you have to follow that guidelines as well. All right, next is foster a positive remote work culture. So you have to participate in virtual team meetings and engage in discussions. Encourage knowledge sharing through group chats or webinars. Recognize and celebrate team achievements even in a remote setup. Okay, so usually companies always have their weekly meetings or monthly meetings, and these are mandatory. Okay, because these meetings are venues wherein you can discuss topics, goals for the company, if you have concerns, or what are your quota, or what are the concerns of your patients and the status of your doctors. So ideally, you really have to attend these meetings even once a week so that you will be updated, and also you will be familiarized with your team. So you will be familiar with your doctors, with nurses, and also you can engage with them and mingle. All right. It's not always, sometimes the meetings are not always work. The topic is about work. Sometimes meetings also conduct games, conduct activities, or sometimes they discuss topics that can boost the morale of the staff. So even if you are working remotely, you will not feel alone. That's the importance. Okay. Next is enhance problem solving skills. So be proactive in finding solutions to workflow challenges. Adapt to technological or procedural changes with a growth mindset. Seek feedback from colleagues and supervisors to improve continuously. So if your immediate supervisors or managers will provide feedback, don't be disheartened, okay? Take it as a constructive criticism so that you can improve yourself, okay? This is not a personal attack on you, but on your output, all right? So there's a great difference between two. So you have to accept the feedback so that you will gain improvement from it. All right, next. So maintain work-life balance and wellness. This is important. So you have to take regular breaks to avoid fatigue and maintain focus, as we have discussed earlier. Follow healthy habits, including good ergonomics in your workspace. Make sure that your working environment, even if you are at home, you have to observe good ergonomics. Okay, engage in activities that help reduce stress and improve productivity. You have to also develop strong critical thinking skills. So make informed decisions by carefully analyzing patient cases and workflow processes. This is very important. It's because every company have their own standard operating procedures. And it's also important that you know the workflow process so that you will not be asking from time to time. All right. Anticipate potential challenges in telemedicine and be ready with backup solutions. So this one is important as well, especially for those who are using telehealth. It's because you are just relying on technology to do the appointment, right? So make sure that your Zoom, your WebEx, or your Teams are working smoothly so that the patient can join the telehealth appointment. Okay. Utilize evidence based practices to support medical decision making. All right. Next is strengthen multidisciplinary collaboration. So it means you have to work closely with the doctors, the nurses, and admin staff to ensure seamless patient care. You have to engage in interdepartmental meetings to align goals and updates, build rapport with colleagues to foster trust and cooperation even remotely. You have to optimize documentation and record keeping. So maintain a detailed and organized electronic health records for accuracy. Follow standard protocols for recording patient information securely. And then you have to make sure that all the documentation complies with legal and regulatory healthcare standards. Okay, then this will be our last slides. Thank you for those who are still staying on the live stream. I hope you all are learning. All right. So last two topics is strengthening multidisciplinary collaboration. Okay, we're done with this. You have to work closely with our doctors and nurses, build rapport with your colleagues, and we have to optimize documentation and record keeping. Okay, so those will be the last topic for our module, how to be a reliable remote team member in healthcare. Okay, so just a recap, we are able to finish five modules for today. So our first module is how to write medical emails and follow-up messages. Our second module is how to take accurate phone messages for medical practices. And then how to handle difficult patient calls as a virtual assistant. How to communicate professionally with doctors and patients. And lastly, how to be a reliable remote team member in healthcare. Okay, I hope everyone that you learn a lot from today's live stream. We will continue, I will try to continue this on a daily basis. So if you want to learn more, and especially for those who are beginners, this is very, very helpful. This live stream, I'll try to do it on a daily basis so that a lot can join. And I will try to pick topics wherein we can do actual navigations on our next live stream. All right. Thank you so much, everyone, for joining today. See you again tomorrow. We will have another live stream. And we will have another new topic that I'm sure you will definitely learn from it. All right. Thank you so much, everyone, and have a great day.